Sure, I'll be there for sure. Don't worry. I'll miss that bam, 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 bam. It's not an easy road. How many see the glamour and the glitter so them think I better rose? Me say, who feels it knows? Ooh, Lord, help me sustain these blows. I cry, it's not an easy road. How many see the glamour and the glitter so them think I better rose? Me say, who feels it knows? Ooh, Lord, help me sustain. Why? From the minute of birth you enter this earth, obstacle there in your way to overcome first. Throughout every day they seem to get worse. Oh my God, cast away this curse. Everybody are trying to make every end each way. The way that them end never, that God you see. No matter what the world may say, out the street. Must have this so I won't accept defeat. Now I'm weary, dying dreary. Got no time to race your big Madonna. It's not an easy road. How many see the glamour and the glitter so them think I better rose.
Another Friday evening.
Who feels it knows?
Gonna get this set for
Lord,
Watagwan.
help me sustain these blows. I cry, it's not an easy road. How many see the glamour and the glitter so them think I better rose. Me say, who feels it knows? Lord, help
If you're
me
jumping on,
sustain
of
these
course,
blows.
you know, looking
Find the
for some
rise to see the
comments
sun.
or
Who you love
some
and who you
reaction,
love.
making
Try
sure that the
to
audio is good before
discredit
we
the
get
works
started.
you have done. Some not satisfied with the post of a life. From the scribes and Pharisees, you got to stay wide. Follow the
There
headlands
has to
in
be
on
some life
both
out there.
sides. And wait and disappear, pray for your life. Righteousness prevail. It's down by my side. Leave a shoulder from the world. You leave him to die. Help us
There has to
all.
be some
Up,
life out
up,
there.
and I hold up my head and cry. I tell you now, it's not an easy road. Oh no, it's not an easy road. I did tell you, it's not an easy road. Oh no, it's not an easy road. Why? I've been traveling morning
All
with
right.
such an heavy load.
Thanks,
Now
Peter.
it's noon and I cannot afford to put down my burden alongside the road. Oh, I've got to hold it. Yeah, I've got to humble myself like a child.
Come
Humble my
on, big up,
face,
big
I've
up,
got
big
to
up.
put up a smile. I'll make up my mind just to have more mile. Oh God, I've got to, because I know that it's not an easy road. I many see the glamour and the glitter, so they think I better rose. Me say, who feels it knows? Ooh, Lord, help me sustain these blows. Once more, it's not an easy road. I many see the glamour and the glitter, so they think I better rose. Me say, who feels it knows? Ooh, Lord, help me sustain. Why, from the minute of birth you enter this earth, obstacle in your way to overcome first. Throughout every day they seem to get worse. Oh my God, cast away this curse. Everybody are trying to
All
make every end each way.
right, all right. Good pause, Buju Banton. Greetings, greetings, greetings. Welcome to Watagwan. My name is Donovan Simon. I'm the president for the Jamaican Canadian Association Alberta, based in warm Calgary. It's a very bright, sunny, warm evening here in Calgary. And Watagwan is our way of connecting to the community, talking about things that our association is doing that's happening in our city, in our country, in Jamaica, in the world. Welcome to June. In June, our plan is to discuss health issues. And today we're going to talk about one of those diseases that affects a lot of Black people, right? And over the next couple of weeks, we're going to talk about a number of others and also get some perspectives, especially because it affects our community. But before we get into that discussion, we have to do the staples of Watagwan, right? One of which is the Patwa word of the day. And this one is going really deep because I want to see how much people kind of really know the Patwa. The Patwa word of the day is Kobich. I was digging really hard to find this one, and this is a description for somebody. So we'd possibly say him or she, Kobich bad or something like that. So if you understand Jamaican patois, you know what that means. Please put it in the comments so that those who are not familiar with it can get to learn a little bit of the Jamaican patois more than just no problem or wagwan. All right. Patois word of the day is kobich, right? For those who know, please share it so that others can, or put a comment so that others can can see what go on. All right. What's coming up? There are two big things coming up. Call it in July, 10th of July, and we're not talking about the Stampede. The Jamaican Canadian Association, we're going to be putting on a couple of activities on the 10th of July. One of them is a cultural showcase. Now, typically we would do something called Taste of Jamaica. We've done it for over 30 years here in Calgary. But this year we're going virtual. So we're going to have a cultural showcase on the 10th of July. Tons of artists showing up to share culture, poetry, song, gospel, DJs, all kinds, music from the 60s, the 70s, the 80s, the 90s, all the way into the 2000s, free virtually, right? Or cultural showcase on the 10th of July is going to start at 6 p.m. It's going to be streaming here on Facebook, streaming on YouTube, and also on the JCAA website. Also on that day, earlier in the day, we're going to have something called Liquor Taste, which is food, right? You know, I go with black people. We have to do the food thing, right? So we're having authentic Jamaican food available for pickup or delivery, right? So we're following the protocols, and even though by then it's very likely that there's a little bit more easing of the restrictions, you can jump online, you can order, you can come through and pick up, or delivery to Calgary, Chestermere, and Airdrie is available. Ackee and saltfish, escovitch fish, jerk chicken, chicken soup, ital stew, right? You want to make sure so you get it. And look at the prices. The prices are awesome. And like I said, you pick up at our space over in the Northeast. If not, we'll arrange to have it delivered for you. There are tons of surprises that we're planning both on the cultural showcase and on the food side. We have some special treats coming from Jamaica for the real authentic stuff, right? So support this one. Proceeds are in aid of our scholarship fund or benevolent fund and our community backpack program, three initiatives that we want to continue doing. So the money goes straight to those three causes, and the food goes where it should go, right? So what we're saying, skip the kitchen that day and get some real Jamaican food, right? We want to share that we're also issuing scholarships this year. Like I said, one of the things we want to do from some of the proceeds from Liquor Taste and the cultural event is to offer additional scholarships. We've got some scholarships that are already in place. Apply for them if you know somebody. Share the word so that they can apply for them. The deadline June 30th, so that the scholarship committee can review them and award some scholarships. We want to ensure that we support our community and people pursuing academic goals. We also want to continue to share that the Calgary Black Chambers also has some scholarships, right? And there are tons of others. If you're on our newsletter, we share those as well. But they have about, I think, 10 to 12 scholarships that they want to give away this year or to award this year. If you know somebody who is seeking scholarships, who is going through tertiary education, tell them please to apply for these scholarships so that they can benefit from all this work that people are doing in different places to support academic pursuit. One of the things I want to continue to ask and to share is our Helping Hands program. We need funds to complete our building, but also to maintain it, right? The Helping Hands program will allow you to get your name or your logo on the donor wall. It's a 16 by 14 foot wall, right? There are different categories that you can support at. And there are various benefits, including being on the wall, being on our website, social media features and stuff like that. And we're going to start running those out at the end of June, right? We're just about getting ready to install the first set, right? There's still time, there's still opportunity for you to be a part of this wall, and it's going to be there forever. What we also want to continue to ask is for your support in getting our library up and running. We need books. We want to build the single largest source of Jamaican and Afro-Caribbean books in Canada. Yes, it's an ambitious goal. I keep saying that. But that's what we want to do. There are already some books on the shelves, but we're looking for a lot more. So if you have some books, if you have written a book, if you know somebody who has written a book, ask them to donate one to the cause, right? So that it can be there and people can benefit from this facility that's there to serve the community. As always, we want to say you can connect with us in different ways. Jump on our website, send us an email, find us on social media. You can call as well, right? There are different ways to connect with us. And especially if you're calling to donate a couple of books, that would be great. But if you're also calling or to order for Little Taste, that is also welcome. You can also jump on the website and order for Little Taste online. It's already up and open and orders are already being taken. So for those who are just joining or joining late, Patois word of the day is Kobich. Right? Let's see, as one comment already. Let's see how many other people will jump on and give their comments. All right, like I said, June, we're going to talk about health. And today we're going to touch the topic of cancer, a big issue. In fact, before I get the guests on, I want to share some stuff. And if you haven't shared the program, share it. Hopefully a couple of more people jump on and see some of this information, because cancer is the single largest cause of death in Canada, right? And as you can see on screen, men are highly affected. As you get older, the risk increases. And while the numbers, I suppose, have been changing, there are lots of little things that stay the same. One is that it is the single largest, cause of death. The Cancer Society provided me with some information about cancer in Alberta. Over 20,000 Albertan residents were diagnosed with cancer last year, right? And just look at those numbers, right? Breast cancer, prostate cancer, colorectal cancer, lung cancer, major issues very much right around us, right? Something that we should understand. But maybe the biggest one for me was looking at some data out of the American Cancer Society as it relates to how it affects the Black community. Black men, highest rate for new cancer diagnosis. Black men and women, being hit by cancer all over, prostate cancer, lung cancer, colorectal cancer, right? Black women, the highest death rate for breast cancer. So it's something that we need to talk about, but also be aware of, because we may not be conscious of how much this affects our community. And that's why we're talking about it. And that's why I have these guests with me today to jump in the conversation and to add some perspective. We've got Dr. Dapo Akinsipe and we've got Yinka Oladeli, right, who are here to share some information with us. One from a practitioner's perspective and the other one from somebody who has had to see it firsthand. And hopefully as we share from both of them, you learn something as we make this all happen. Doc, you have to unmute. Yinka, you have to unmute as well, right?
Yes, I've muted my phone.
Okay, awesome. Welcome to the program. Thanks for being on Wataguan.
Thank you for having me. Appreciate it.
Thank you for having me today.
All right, before we jump into the questions, we do this patois thing. Anybody, any of you know the word?
I'm learning.
I'm learning.
All right, all right. Well, we'll check the comment section. We'll see what is out there.
Yeah.
All right, but let's jump into discussion. And Doc, maybe I'll start with you. Help our viewers understand, first of all, what is cancer?
Yes. So cancer is essentially pretty much you're having tumor cells or growing in your body for the most part. But the whole premise of it is your cells in your body are rapidly dividing more than they should be, causing a tumor. Or in general, the checks and balances in your body that prevent your body from rapidly dividing cells end up being some type of cancer. Now, of course, there's different types of cancers, and I know you went into statistics, but pretty much cancer generally is developed from your body within, outside, due to your cells not acting the right way they should act for many reasons, which I'm sure Donovan will probably delve into some questions into that. Yeah.
All right, so now we understand what it is. Like you saw on the screen, I shared some of the demographics on its prevalence in the Black community. Well, is there a reason behind this?
Yes, actually. Well, the number one main reason is screening. So generally, if you look at the statistics, although in the US they keep better statistics than we do here in Canada when it comes to race, just because of Canada was, developed in a way to say, okay, we don't want to look at race, right? But the US, they keep really good data. In the States, part of the reason why a lot of times cancer is higher with Black people is because of healthcare disparities. Generally in the US, generally Black neighborhoods tend not to have as good access to healthcare as do other or generally white neighborhoods. I mean, indigenous people too are similar to Black people, but so we don't have as much access to healthcare. And so we generally tend to be higher. Then there's certain cancers that sometimes are a little bit more prevalent with certain races than others. And of course, I'm sure we can go into that later, but those are kind of like the two main reasons why it's more prevalent among Black people.
Okay.
Yeah.
Yinka, let me bring you into the conversation because not only do we have to deal with it individually when we are diagnosed, but our families have to. So let's talk about the experience of being in a family where a family member is diagnosed. Talk us through the emotions and the process and some of the things that one experiences.
Thank you. Well, I'm not a doctor, but from from my lived experience as a caregiver, and we've been able to put this into a book. I'm also working on another one, just mainly for caregivers. Most of the times when cancer is being diagnosed, it's usually very sudden. And comes with a shock, with a rude shock. And the person that is being diagnosed with cancer is already gone. Like, you just see the person literally sitting there, but the person is not there. So the onus is on the caregiver to stand up to the plate. And I tell you, it brings a lot of sadness, anxiety, anger. Even sometimes you feel hopeless because you don't know what's going to happen. Some families are torn apart because of cancer, because you don't know what's going to happen. Especially when the patient is going through it, the wife or the spouse sometimes doesn't know what to do. If you do not have the right information, you'll just be going up and down without knowing what to do. We all come from Africa or wherever we came from, and where we came from is very far. Canada or US or whatever is kind of an individualized setting, whereby if you do not have a network, you may have to go through it alone.
Yeah.
So I'm going to be talking from the perspective of a caregiver.
Yeah. All right. So we're going to come back to that. Doc, let's go into this whole process of diagnosis and screening, right? What are some of the things that, people watching, people should be aware of as it relates to certain types of cancers, right? as it relates to this whole screening and diagnosis process?
Right. Yeah. So the first thing is if you have a family history of some certain cancers, for example, colorectal cancer, you should, for example, this is an example, if you have a parent that was diagnosed with colorectal cancer at 50, you want to start screening from the age of 40. And the reason why is this. Generally, it takes, although usually by the time you find out you have cancer, it's usually later in the game. But we found out it takes sometimes, depending on the type of cancer, for example, colon cancer, takes about 5 years, sometimes 10 years to actually develop. But you don't actually have symptoms until maybe you have a year or 2 or 3 left, right? So usually we like to screen many years before. So that's one thing. Number two, and this is, I'll go to men, go to women. Again, for colorectal cancer, both men and women, from the age of 50, make sure you start getting stool occult blood tests. And make sure you ask your doctor about that. In the US, from the age of 50, colonoscopy. Here, the studies are showing that yearly stool tests are usually okay, unless if they notice a bit of blood in your stool, then they have to do a colonoscopy. Now, with that said, Canada hasn't caught up to this yet, but in the US, one of the things they're starting to do for Black men, because they found that Black men have a higher rate of colon cancer than any other race, they started screening them from 40 now. So if you have concern, or even if you have a remote family history as a Black man, especially, or even as a Black woman, make sure you talk to your doctor, hey, I want to start getting stool screenings from my 40s, whether 45, whatever it is. If there's remote history of cancer, even if it's your uncle from Timbuktu that has colon cancer, because we're at higher risk of that, make sure you advocate for that, right? So you gotta talk to your doctor about that. For women, I'll start with cervical cancer. That's the most painful one because cervical cancer nowadays is very preventable, right? So for women, make sure if you're sexually active, because being sexually active increases your risk a little bit of cervical cancer. Make sure you start screening from the age of 25, at least. In the States, it's 21. So here you can actually, I've had patients sometimes ask for 21. You can start screening at 21 if you're sexually active 3 years prior. And make sure you do pap smears every 3 years or every 2 years, depending on what they find. Your doctor will tell you how to do it. So that's important. Generally, by the time you get to 70, you probably don't need to be doing pap smears anymore because if you haven't had cervical cancer in 70 years, there's a chance you probably won't have it anymore. And then back to men, generally in Canada, from the age of 75, we generally stop screening for colon cancer for many reasons. But then going back, the other one, which is very leading among women, is breast cancer, because there's been a lot of research for breast cancer. So breast cancer isn't a death sentence like what it used to be in the 80s, right? Because they've put a lot of money into research. Which will then go to prostate cancer and after, which there hasn't been a lot of money, but they're working on it. For women, generally, when you get to the age of 50, mammogram ultrasound every year, every 2 years, depending. For some women, we even start screening early in their 40s. If you have a family history, you want to start screening really early. If your parent had the BRCA gene, right? There's BRCA1, BRCA2. Usually people have both. If you have one or the other, you're a bit increased risk for breast cancer. And so you want to screen early. Also, you're a little bit increased risk for ovarian cancer, which unfortunately is actually the most deadly cancer among women. The problem with ovarian cancer is there's no way to screen for it, right? The only way you can screen is if your parent had it and they start testing you early. Unfortunately, ovarian cancer, most people find out they have it, either incidentally, let's say you're doing a test and they're like, whoa, you have ovarian cancer. But most of the time, it's when you're already at stage 4. And so the treatment for ovarian cancer is a little tough. When people hear ovarian cancer, oh my God, it's a big issue. So if you have a remote history of somebody in your family with breast cancer or ovarian cancer, as a woman on your mother's side, not your dad's side, make sure you talk to your doctor about that, right? So these are generally the screening things. Prostate cancer is a little difficult because obviously for men from the age of 50, your risk is a little bit increased. If you have a family history, let's say as a man, your dad had it, right? You want to start screening earlier, right? So from your 40s, something really early. because prostate cancer, a lot of times too, although it's not as bad as ovarian cancer, we usually pick it up when it's stage 1, stage 2, sometimes stage 3. So usually nowadays with radiation, all the other stuff we have, prostate cancer isn't as bad as it used to. And then there's a bunch of other cancers, which pancreatic, but those ones I know people want to know the main ones, right?
Yeah.
Go ahead and ask about the other ones.
We're going to come back to treatment. Yinka, I'm going to bring you in here because two things I want to get your perspective on. One is the taboo about the diagnosis, right? Especially within our culture. And the second part is getting into the treatment as the caregiver and supporting the family member as they go through that process. Let's talk about that a little bit.
Well, the myth that we have in our community, before I go to that, thank you, Dr. Akishipe. I think the first thing is to encourage our people to get tested. People don't like to go for testing.
Yeah.
And I don't know why. Sometimes, like men, especially men, maybe we need to do a program for men alone to get tested. I'm talking about this from experience. If my husband wasn't doing his testing every year, like a yearly medical checkup, maybe they would not have found out.
Mm-hmm.
And I did talk to some men that you need to get tested. So, oh, no, maybe until it's on the deathbed, then you go for testing. We need to pacify or drag our men to get tested. It's free in Canada, for God's sake. It's just for you to book with your family doctor and they will do the necessary testing for you.
Mm-hmm.
Now, in our community, you are saying the myth that we have. People think when they say, oh, somebody have cancer, it is a death sentence. I don't know if you got a copy of our book. It is no longer a death sentence because, one, if something is diagnosed at the early stage, they will be able to treat them,
Mm-hmm.
right? They will be able to treat the cancer if it is diagnosed at the early stage. Even if it is not, look, there are technologies now, there are lots of research that are going on right now. I've done a lot of research, even though I'm not a doctor. Mm-hmm. I've done series of just a lot of research. I attend conferences just to know what is out there.
Right.
Are the doctors just sitting down or are they doing research? So a lot of research are coming on. Thank God for the government of Canada. What's it called? Cancer treatment is actually free. They give you the medication free, but there are some that you have to pay out of pocket. And the other thing is we need to understand, or our people need to understand that cancer is not contagious. Mm-hmm. The fact that your spouse or somebody has cancer doesn't mean it is contagious. I give you an example. When my husband got his first chemo, he reacted to it. And he had hiccups. And fast forward from that, he spent the next 3 weeks at the hospital. People actually thought it was a cancer attack took him to the hospital, but it was the reaction from chemo.
Right.
When people were coming to see him, some people would tiptoe. And I'm like, I'm sitting here. He's not going to jump from him and come to you. Right? So I'm just trying to say that it is not contagious. Let us reach out to whoever is being diagnosed with love and care.
Right.
And that is part of healing.
Right.
And some people say, oh, maybe cell phone causes a cancer or something. Look, I have a family member. What I'm passionate about the African Cancer Support Group is I have a family member that died of cancer back in Nigeria. We didn't even have cell phone. We did not even have any type of phone in our house.
Right.
And the person still died. So, and somebody say, oh, microwave oven, just so many things they say causes cancer, but they are not from research. And there are so many things that people say out there that, oh, maybe it causes cancer. But no, the thing is, all of us, we have the gene, we have cancer gene in us. And Dr. Dapo, you can correct me if I'm wrong. We all have the cancer gene in us. It is the person whose own is being pass a threshold and get to a particular organ, right? That is when if the cell grow to maybe to kidney, maybe the person will have a kidney cancer or something. So we all have it. The thing is, we all need to get tested.
Right. Yeah, and I see Bob, long time no see, I see Bob making a comment saying all men over 40 years old should get screened annually. He's recommending that, right?
Yes.
Doc, I want to bring you back into the discussion here because Yinka started to talk about what are not causes, even though people talk about it, 5G and cell phone and microwave. But let's talk about what are some of the causes, and also let's also explore how diet affects this.
Right. So, and then another thing too, as well, is, it's not a spiritual attack. There's some, because, we have a lot of, taboos in African culture, but just to get that away. But yes, going back to things that could cause it, of course, although, yes, most cancers are caused by the checks, just like Mr. Ladele said, checks and balances in the body being off, which is what, when you asked me initially, what is cancer? I said either your cells rapidly dividing or your ability for the body to give checks and balances off, and then it over proliferates, right? Now, most cancers occur because of that. There are few times that some cancers are caused by external, i.e. The big one for pretty much all cancers, smoking cigarettes. That's the big one. Before we thought it was only lung cancer, but smoking cigarettes can cause your cells to rapidly divide anywhere in your body, and it can lead to any cancer, whether pancreatic, whether kidney, whether uterus, whatever it is. So smoking is the big no-no. I would definitely recommend avoiding that. Prior to, although now we don't have that issue anymore, unless really old homes, asbestos was found to have that. Exposures to silicone, aniline dye, all these things are old, right? That we hopefully don't deal with anymore. Some of those things can cause your cells to rapidly divide and cause cancer. Then, of course, it's always important, of course, to eat healthy. Sometimes some of the preservatives that we have in our food sometimes can cause your cells to rapidly divide and cause problems. But I've also had patients too that have eaten healthy and exercised, and they still got cancer, and they were young, right? So even though I'm pro dieting and exercising, and I'm pro avoiding, unhealthy food and stuff, because again, those things in general will reduce your risk of cancer, right? So we can't throw those things to the wind and say, well, this person got cancer at 30 and they exercise all the time, right? Those things generally reduce your risk. Generally, a healthier lifestyle, diet, exercise, all that good stuff reduces your risk. Of course, not smoking, all those things. But at the same time, people are healthy and still get cancer. So hence why you still should get screened.
Get screened, yeah.
Right? Because again, your cells can decide to rapidly proliferate for one reason or the other. And nowadays, some of the studies are even showing that chronic stress, if you look at a lot of us that came from African backgrounds, people had very stressful, they just used to stress all the time. And so they're stressed. And stress itself can cause your cells to rapidly divide and lead to sickness. Because think of it, stress can lead to high blood pressure. Right? We know that as a fact. Why can't it lead to cancer?
Right.
So now we're finding out that some people, it's stress, even though they're healthy. So figuring out stress reducing mechanisms also reduces your risk of getting cancer.
Yeah, I'm glad you used the word stress, because I want to bring Yinka in here as the caregiver and speak to the whole issue of the mental components that kick in when you have to now play a role that in some cases, you didn't plan for at that point, or some of the demands that come with it are just really demanding. Let's talk about that element for the caregiver and for the families.
A lot of stress, burnout. You are burnt out, just name it. And when you are burnt out, sometimes you cannot even think very well. And as a caregiver, you are the ears, you are the eyes of the patient. Sometimes the patient doesn't even know what to do. So you are the one that's supposed to do it. You have roles and responsibilities. And if you need a lot of patience, if you don't have patience, you cannot deal with a cancer patient, right? So when you are burnt out, what do? You can take a self, like 1 step or 2 steps back. Give yourself self-care. When you have that, when you give yourself a good self-care, you by the time you are okay, or you can exercise. Exercise doesn't mean you have to go to gym. It could be a walk around your house. Why? Because you cannot leave the patient at home and say you are going to the gym. Just walk around your house. And when you are burnt out, it affects your mental health. It affects everything, your psychological, socially, and emotionally. Sometimes any small thing will just trigger anger in you because you are stressed. And stress can cause anything. Stress can damage things. You are the one that will deal with the doctors. Caregivers are the one that knows when a particular medication is right or when a particular medication is not working well, and be able to liaise with the doctors. At a point, the nurses, they were like, wow, you should get your certificate. Because I will research everything. I will research the medication. And I'm saying, no, this is wrong. Because there are some medications, like when they prescribe it, by the time I read the pros and cons, I'm like, no, this will even make him to be depressed more, and they will change it. So caregivers need to be at alert at every time.
Right.
At every occasion, even when you are at home, where you cannot get good sleep, trust me. And when you don't have good sleep, your body tends to ache. Why? Because in the afternoon, when the patient is sleeping, that's when you get to do few things.
Right.
At night, like when the patient is sleeping, you have to make sure everything is okay, because sometimes you have to check, is he still breathing? Is she still okay? Right? So with that, and you do that day in, day out. That's why I hope that's from my own perspective.
I'm going to bring Doc in here because, Doc, I want you to kind of help us understand the whole treatment regime, depending on the different types of cancers, but especially the ones that are popular within our community, and the role the caregiver plays because of the likelihood of certain responses to the treatment plan.
Right. So, being a caregiver for someone with cancer is a very hard job. I'm sure Salali can probably tell you stories. It's a very difficult job because it's totally new. If you haven't had cancer before and you want to take care of somebody with cancer, it's tough. But the reason why is this. A lot of the cancers sometimes require chemotherapy or immunotherapy. And aside from the fact that it could make the person weak, nausea, vomiting, some of them could also mess with the person's emotional state. And when that happens, then they carry out their emotions on their caregiver, not because they want to, but because some of the side effects of the chemo could do that to you, right? So things you want to be aware of. Some people are lucky, they get chemo and they really don't have much symptoms. But most people that get it will have side effects. And the reason why is this: when you get chemo, and I'll start with chemo and I'll go to radiation next. When you get chemo, immunotherapy, sometimes proton therapy, the goal of these medicines is to destroy, because remember we said cancer usually is rapidly dividing cells, right? Yes. So the goal of these medications is to try to target these rapidly dividing cells, because they have a target. But at the same time as they're targeting it, they're also targeting rapidly dividing cells that are normal, i.e. Your skin, right? People don't know, but your skin is pretty much dying a lot, right? Your skin rapidly divides, so people get skin problems. Your stomach, your GI system is rapidly dividing, so the chemo goes after and they get nausea, they get vomiting, they feel really sick, right? Your hair, it falls off because it targets the hair, right? That's why people on chemo usually lose their hair, right? And of course, if you're nauseous and vomiting, you're gonna lose weight sometimes, right? Now, there's some immunotherapies that make you gain weight, but usually they make you lose weight, right? And so these are things that you want to kind of watch out for as a caregiver. Another thing as a caregiver, I have to kind of stress, and because and I know it's kind of a little bit off the topic, but mental health, like Ms. Oladile said, right? Black people, we don't focus on mental health. Mental health is a whole topic on its own.
Oh yeah.
But, you have to take care of your mental health because you're going to go, this is going to be the ride, right?
Yes.
So there's nothing wrong with seeking therapy, okay? And I'll explain why, right? You go to a doctor because you can't cure yourself, right? Think of your mind like that, right? You go to a therapist because as much as we think we can cure our mind, sometimes we can't. And so you need somebody else to be able to bounce off ideas and to give you some coping mechanisms, right? Because if you're mentally checked out and that other person is mentally checked out, you can't take care of that person effectively. You can, but not effectively, right?
Right.
And other parts of your life suffer because of that, right? So these are things that you always want to keep in mind if somebody's going through these treatments, because they do have side effects.
Right.
Yeah.
And well, you just talk about chemo, but there's immunotherapy and a range of others. And in some cases, some people, try natural stuff, right? Because there's always that search for the cure or something to get you back. But before I change the topic, how does the stage and where you identify what's going wrong, how does that influence the treatment plan as well?
Quite well, depending on the cancer, but quite a lot. The reason why is because, for example, I use prostate cancer, and this is for men because that's why we're encouraging men to get screening. Prostate cancer that is caught in the early phase, stage 1, can just, sometimes you don't even need radiation. All you need is surgery and they just take out the cancer. That's it, right? Or sometimes radiation is kind of like they have this targeted radiation stuff and they kind of just beam it at the cancer and it kind of just destroys and that's it, right? But when prostate cancer becomes stage 3 or stage 4, meaning it starts going to your spine, it starts going to other parts, then you have to use chemo, which has way more side effects than other stuff, right? So the earlier you catch it, generally, again, every cancer is different. Generally, the less harsh the treatment will be, and generally the survival rate is a lot higher because now you have to target all these cells that have kind of gone all over the body, right? And that becomes a lot harder, right? Once it hits stage 4, people come out of stage 4. Don't get me wrong, it happens. So it goes back. If you hear you have stage 4 cancer, it doesn't always mean it's a death sentence, right? Just like Ms. Oladile said, there's a lot of treatment modalities out there. But also sometimes some stage 4s tend to be, but at the same time, it doesn't mean you should give up completely, right? So if you can catch it earlier, yes, the treatments itself and the ability for it to be treated completely is a better option for you. Yes.
Okay. Yinka, I want to go down a road with you here on culture. Like you say, all of us Black people, we're related to Africa in some way, shape, or form. What are some of those cultural things that are affecting us as it relates to us understanding, dealing with, and preparing ourselves for the things that we can do as it relates to cancer?
Well, culturally, I don't think there's anything we can do because cancer is a global thing.
Mm-hmm.
It's global. It can happen to anybody because right. So it's global. Now, I'm from, and I know you are from Jamaica. What can you do when they say there is cancer? Nothing. However, because we are Blacks, we tend to add religion into our culture. When they say something happens, the next thing is, oh, it's not my portion in Jesus' name. Meanwhile, we needed to face the reality.
Mm-hmm.
We need to face the reality. Culturally, when they say, oh, this person has cancer, you quickly go to the farm or go to the bush, go and look for leaves, go and look for herbs. Meanwhile, God has given everybody abilities and he has given the doctors the knowledge. And all of us cannot be doctors. That's why they have the knowledge. While we pray, I will say we add, while we pray, we take action, and the action is to listen to the doctor while we do whatever we are doing culturally.
Mm-hmm.
I'll give you an example. A few years ago, a lady had cancer here in Calgary. They told her to get a treatment. She said no. She was going to take herbs and she was going to pray and believe God. By the time the person decided to take the treatment, it was already late. Why am I saying this? We have our culture.
Right.
If we want to use our culture, it's either you are doing Shango, like the thunder, the god of iron, right? Or you go to the bush. Those ones will not bring chemo. They will not bring cancer something.
Right.
There are treatments. Why we pray, there are treatments that we need to take. We pray, we take treatments, we eat healthy.
Right.
That's what I can say.
Yeah.
Whether it's culture, whether it is religion, whatever it is, we need to listen to what the doctors are saying. Some people will say, oh, don't listen to the doctors, just take these herbs. And I don't think, look, I had so many things when we were going through our journey that, doctors are just lying. Doctors are just doing this. Why don't you put this together? But I'm learned. I can read, I can study. And when you read what the medications can do, even though it has its own effects, it has its own side effects, right? But the good it will do is more than the side effects. It's better than the side effects.
Right.
And very few cancer have single known cause. Very, very few. And most cancer can be caused by maybe some complex mix of many risk factors that we don't even know. I was asking my husband's oncologist that what could have caused this. This man doesn't drink, he doesn't smoke, he goes by himself, he doesn't do all those things.
Right.
Still he has cancer, right? And I'm just going to jump in what Dapo said the other time about the Black people. Why we see that, it's more within the Black community is most Black people, if not all, don't get tested. So by the time they get tested, they will now discover that they have cancer.
Right.
And in Canada, we don't have the statistics. Most statistics that we have, they are from US.
Right, yeah.
Caucasians also have cancer. When you go to Tom Baker, you see the number of people that are there. Cancer, it goes across everybody.
Right.
It is just because our population is not much. So when you say, oh, this person has cancer, this person has cancer, what is the ratio? The ratio of the Black compared with the Caucasians.
Right.
You get what I'm saying?
Mm-hmm.
But having said that, people need to get tested. That will be my denominator.
Yeah, and I think that's a big message. I see Bob saying, people need to make sure that they're pushing hard. Doc, we're looking at the clock and we're running up against the time. If there was one message that you had to share with somebody watching this video as it relates to their health and cancer, from a medical perspective, what would that one message be?
Healthy lifestyle, A. B, get tested. Screening. Of course, if you're 20 years old and you have no family history or nothing, your doctor is probably not going to check you for colon cancer. But talk to your doctor, make sure you know what you need to screen for, and of course, live a healthy lifestyle. That's it.
Okay. Yinka, if you get to, as a caregiver and somebody who has experienced it real close up, and I want you to give a plug to your support group, right? That's one, and the book that you have written. What would that one message be?
I would just say, don't swallow your emotions. Mental health can affect anybody. Loneliness and isolation can affect people as well. And I'm just going to talk about our support group. We have what we call the African Cancer Support Group. It is for people from Africa, Caribbean, and Black Canadians. We offer emotional support. We offer different things, and I'm going to tap into that. I'm going to get in touch with you. We want to bring Black doctors. We are going to be creating awareness, going to different associations, whether it's virtual or whatever, so that when we create awareness, let people know what symptoms, what to look for. What are those things that, oh, because my husband went to the doctor because of just ordinary pain, and from pain to myeloma. And that is very, very rare. There are so many rare type of cancers out there right now. So what are those things that we need to look for? So, and of course, my book is called Second Chance: Surviving the Battle of Cancer, right? It's on Amazon or on my website, oladele.ca. So Deji, Dapo, I'm going to get in touch with you. We are trying to bring different Black doctors together, because now we are registered as not-for-profit. We want to be able to reach out to our people, because when we were going through our journey, there was nothing, we could not find any Black support group, and that's how we started it.
Right.
Thank you.
Yeah, that's awesome. So, you know, that's something that I know you have shared with me, Inka, we've shared within our association, that at least there's this group that helps to support people, right? Because that is critical. You know, we could go on and talk a lot more, but I think a lot of information has already gone out, and hopefully people watching this video pause, and if there's one thing I want you to take away from it, or let's take two: screen. Go talk to your doctor, you know, let it be a part of the conversation as you have your medical conversations. And like you said, if you are in that role, take care of yourself. Because if you don't take care of yourself, you can't take care of the other person very well, at least not for very long. Dr. Dapo, thank you for joining Watagwan. Yinka, thanks for joining Watagwan and sharing the information. We really appreciate it.
Thank you.
Thank you very much. Thank you so much. Thanks for having us.
And guys, for those watching, we're going to keep the conversation going on in June about health issues. And I want you to share the program, share it with other people. I know it might not be as exciting as if we're talking about some other topics like we did in April, but this is important for our community to know, right? Next week, we're going to talk about diabetes, right? In Jamaica, we call it sugar. Another disease, another health issue that Black people or community is affected by, maybe disproportionately. I don't know if that's the right word. So 7 o'clock next week, we're back again with Watagwan. The week after, we're going to talk about natural options, right? You know, we mentioned it today, but we're going to talk to somebody about, you know, what are some things that we can do, that we can look at. You know, people go back to the herbs from time to time, right? And then for the last week in June, we're going to talk about female issues. The fibroids, the hysterectomies, the things, you know, vaginal discharges. Dr. Yanati is going to be here with us and say, okay, why are these things happening within our community, and what are some of the things that we should learn and the things that we can do? So June, Health Month, health issues, that's what we're going to talk about on Watagwan. Thanks for joining the show. Follow us on our social media platforms, Facebook, like us, share. Those who join late, part word of the day is coverage. Right, that's how people coverage, man, trust me, right? But we're going to do it again next week, same time, same place. Jump on our website. You can start ordering your meals as you skip the kitchen on July 10th. It's no too early, pre-order. All right, take care. It's nice and warm here in Calgary. Get out and, you know, have a walk, practice something healthy, right? Until next week. See ya.
Thank you.
And that's what I make them think it. So